So now I invite Dr. V.C. Mehta, and I think he'll be talking on trifocal lenses to improve the quality of life study results. So I think moving from modified monofocal to EDOF and now to trifocal lenses, I think all to you, sir.
Oh, thank you. Good afternoon, all of you. I'm going to digress a little bit from the technology talks and go into something which is health economics. So most of the time when we work up with the patients come to you for a counseling, and the most important question they ask is, which lens should I go in for? And the premium lenses usually have a very high cost, that is the highest kind of a package. And the next question that comes to the patient's mind is, what is the benefit if I spend so much of money? But quite often we are unable to convey the exact amount of benefit that the patient is going to have. And instead, quite often we talk about halos, glare, reduced contrast sensitivity, etc. So here we indulge in a study which is going to quantify the benefit that the patient is going to get in case the patient opts for a bilateral panoptics versus the bilateral monofocal lenses. These are the disclosures, and how the study was done was we took into consideration the quality of life, the lifetime cost involved in bilateral panoptics versus the bilateral monofocal, and willingness of a patient to pay. Now, you can measure the quality of life, and quality of life measured in quali years, that means one quali is equal to 1 year of perfect quality of life. And for us, as far as the cataract is concerned, the quality of life is based on the need for glasses for daily activities, visual disturbances like glares and halos and starbursts, or adverse surgical outcomes. So we put all this into one, and then we decided to run the model. So over the period of time, we estimated following things, that is quality of life improvement from each IOL, expected lifetime cost of each IOL, and incremental benefit of panoptics compared to a monofocal IOL. And this we decided then to find out what is the quantification of quality of life and what is the net monetary benefit. These are the things that we added into the model. The cost of procedure, about 1,10,000 for a panoptics, 45K for the monofocal. Cost of glasses per year. In panoptics, you hardly need glasses, but in monofocal, you need either the patient gets a reader's distances, bifocal or progressive. We also included the visual disturbances, capsulotomy, etc. And then we calculated the quality of life. The quality of life gain in a monofocal IOL was 6.12, while in a panoptics bilateral was 6.45. That means the quality gain of 0.32 more in a panoptics IOL compared to a monofocal IOL. Now, this against this, the lifetime cost of glasses is definitely significantly low in a panoptics IOL, while it is about 35K for the rest of the life for the monofocal IOL. So here now the patient can understand that I am getting a good quality of life, and at the same time I am kind of paying little more initially, but I not end up paying continuously for the cost of the IOL. So the high cost effective treatment for cataract patients. So lifetime additional cost of bilateral panoptics is 224, while that of the monofocal is 129. Now the difference is around 95,000. And for that 95,000, they get a quality of 0.32. Now, the patient can kind of spend this much of money? So we went back to the WHO standards, and it says that the threshold for willingness to pay for a quality of life gain of 1 equals around 1 to 3 GDP capita. That means Indian GDP, if it is counted in PPP, it is around $8,000, and these are around 6,09,000 rupees, whereas for one quali gain they are paying 2,95,000, quite less. So it is very effective, it is very cost-effective treatment strategy for a cataract patient in India, and it is ratio is definitely much below than the WHO recommended standard. So PanOptics provides a good, this is the only IOL which can genuinely make the patient spectacle independent. So if you have worked up the patient very nicely and thoroughly, then you can definitely suggest this IOL for the patient. So to give a conclusion to the patient, I tell them that a bilateral PanOptics will incur a one-time high cost, but a lifetime monetary benefit of not having to spend for your glasses, and a lifetime of improved quality of life. While as a bilateral monofocal IOL, the first cost is going to be the less, but lifetime recurring expenses are going to be more, which when added up, which will much more than a bilateral PanOptics IOL. And at the same time, there will be a lifetime dependency on glasses for every activity that you do in the nearby. Now, when you explain this to the patient, a lot of patients are willing to go in for a trifocal PanOptics IOL than a monofocal IOL. So I hope that this kind of a study helps us to come across better to the patient in selecting an IOL for themselves when a cataract surgery time comes. Thank you for your kind attention.
I think, Dr. Mehta, that's a wonderful workup that you have done, and I think if this is circulated to the entire All India Ophthalmological members, I think this could help in upgrading their practices.
Okay.
What is the average expectancy of life that you had taken in this?
So that depends on the WHO this thing,
because
and maximum we had counted up to 20 years.
Because most of the patients end up saying, Doctor Sahab, 2-3 साल ही तो जीना है.
हाँ वो बराबर है, लेकिन अच्छी तरीके से जीना है.
Thank you very much, sir. That was really a wonderful calculation, and I think that will be a game turner for